Welcome to the Resilient Performance Podcast. I'm your host, Doug Kachijian, and today I'm joined by Dr. Ken Kamler. Ken Kamler is a microsurgeon who practices surgery of the hand in New York and extreme medicine in some of the most remote regions on Earth, from the Andes Mountains to the Antarctic to the Amazon rainforest. He has gone on many expeditions with National Geographic, helping to carry out geological research and precision mapping of less traveled areas of the world. He has also served as the chief high-altitude physician in research by NASA, helping examine the human body's response to high altitudes. He has also chronicled his adventures in the books Doctor on Everest and Surviving the Extremes, A Doctor's Journey to the Limits of Human Endurance. His treatment of the climbers in the largest disaster to happen on Mount Everest was portrayed in the book Into Thin Air and in the IMAX film documentary Everest. Dr. Kamler was Vice President of Research and Education for the Explorers Club for 10 years, former chairman of its Science Advisory Board, and a director for 12 years. He was recently re-elected as director. He received the coveted Explorers Club Lowell Thomas Award in 2009 for outstanding achievement in exploration. He has been an explorer in residence at the American Museum of Natural History, a consultant for NASA and for National Geographic Adventure, and a commentator for Outdoor Life Network and CNN. I first learned about Dr. Kamler while reading his book Surviving the Extremes. I was undergoing my medical training in the Air Force at the time, and the subject matter of his book was actually really relevant to what I was learning there, and it turned out that we had a mutual friend in common. I had a close family friend who was a nurse who worked with Dr. Kamler in the operating room. And when I read his book at the time, I thought to myself, this would be a really cool person to meet. And we met coincidentally through that mutual friend and have forged a friendship ever since. I think you'll enjoy Dr. Kamler's perspective on things. He has some great insight into how to live a fulfilled and varied life. And I think no one's really embodied that more than him. How does a hand surgeon from Long Island develop an interest in extreme physiology and environmental medicine to the point that, one day you're basically the lead medical practitioner on an Everest expedition? That's quite a journey, I would say, right?
Yeah, it is quite a journey, and it was taken step by step, and I can bring you through it if you like. It all started when I was a kid. I was a precocious reader. I grew up in a housing project in the Bronx. I was a precocious reader, and I found this book called Annapurna. And being, I guess I'm probably about 6 years old or something, or maybe less. No, probably less. I pulled that book down from my father's bookshelf. I call that my first climb, actually. And I took it down just because the name sounded funny. I had no idea what a word like Annapurna could mean. And as you probably know, it turned out to be a classic mountaineering story about the highest mountain ever climbed at that time. That was before Everest. And the whole idea of these huge mountains in big open spaces on the other side of the world absolutely fascinated me, because I was growing up in a housing project in the Bronx. And I got that idea about exploring big open places, very far from where I lived. But growing up in the Bronx, no one even, thought about mountain climbing or talked about it, or, thought I was nuts if I even mentioned it. So I satisfied my urge to explore by getting a microscope. And I really loved my microscope. I explored all the worlds within a microscope. That just really fascinated me. And my enjoyment of the microscope led me to appreciate biology and then medicine, because I realized that the human body is by far the most complex structure in the whole universe, and the structure with the most to explore. There's more exploring to be done in the human body than anywhere in outer space or anywhere. So those mysteries captivated me, and my interest in medicine and physiology led me to become a doctor. And I still never lost my interest in microscopes. And I actually went into hand surgery because it's a very delicate field of medicine. It requires a lot of microscope work. So that's satisfied my urge to work with a microscope. But at the same time, I never lost my interest in exploring the great outdoors as well. And it was sort of like fate that happened. I was already an intern in a hospital, and we got a patient into our service who had been climbing in North Conway, New Hampshire, and fell and fractured his femur and was brought to my hospital for treatment. And while we were taking care of him, I actually got pretty friendly with him. And he told me, if you ever want to climb, and he wrote down this phone number, and he said, give this guy a call. He can always teach you how to climb. So I kept this in my pocket at first, and then eventually put it in my desk drawer where it stayed for 2 years. And then I had a vacation coming up in my residency. I had a 2-week vacation, and I had no real plan on what to do with it. And I just said to myself, this is it, now or never. Didn't want to see myself going down the road of a professional doctor who lives and breathes, his work and has no time for anything else, and lives essentially a very limited life within his practice and within his community, which is great. But I wanted to expand beyond that. So I had 2 weeks, and I decided that I was going to take these 2 weeks and learn how to mountain climb. I called up the number that I had in my desk, and the guy who answered said, sure, come on up. He was a professional climbing guide, and I went up to New Hampshire. And the day before I got there, he had fallen himself and fractured his ankle. So I said, oh, this is it. I'm losing my chance. But he said his roommate is a Green Beret who specializes in mountain warfare, and he would just take me climbing. So I said, great, I'll go with this guy. But I figured I have nothing in common with this guy because, I'm a kid from the Bronx and from a housing project. This is a Green Beret from North Dakota who had been in Vietnam for 2 tours. I figured, boy, we're not even going to speak the same language. But it turned out that we actually hit it off really well. My idea of a Green Beret was not at all what he was. He was a very sensitive, smart guy who played the violin and read poetry. And we actually hit it off very well. And he taught me how to climb. And he loved the idea that I was a doctor. And he said he's going to Peru with a small group of climbers. And would I be interested in going with them? And I was thrilled with the idea, but also scared because I knew I was not at the level of these guys. And they were taking me along as a doctor. And here I was, an orthopedic surgery resident, planning to specialize in hand surgery. But I realized on this expedition that we were going on, if anything went wrong, they're going to turn to me. I'm the doctor. And I can't say it's not my specialty. I'm the doctor no matter what went wrong. Anything from fractured skull to athlete's foot, no matter what, I had to treat it. And at that time, there was no such thing as a Wilderness Medicine Society. There was no such thing as a specialty called emergency medicine. Those things didn't exist. So what I did was I literally sat down and thought up every kind of problem I might encounter, every illness and every trauma that could possibly occur on the mountain. And I literally wrote down each one on a card and looked up, if I didn't know, how to treat it. And I had a whole pack of cards. I put those cards in my pocket, and I took them with me to Peru, where our expedition was. And I was sort of hoping I would never have to use them. I was worried enough to just stay up with these guys who were so much better climbers than I was. So we rented a truck, and we took the truck up a mountain to our first site where we wanted to climb. In Peru, you can get very close to the climbing spots by renting trucks and going through valleys and ravines. So we took our truck loaded with gear up the mountain, and literally as we were watching another truck similar to ours come down the pass in the other direction, we saw it teeter and fall over the ravine and tumble down, land upside down, literally right before our eyes. And right then I realized that I hadn't even started climbing, and I was already going to be called on to be the doctor. It took us about 2 minutes or so to get to where they were, and that was critical because that gave me sort of 2 minutes to calm down and to remember I had all the information I needed in my pocket. And I had treated emergencies in emergency rooms, and I realized that this is just like an outdoor setting, but it's still, human beings with trauma problems that I've seen before. So we got to the site, and sure enough, there were some injured villagers. I took care of some fractures, the lacerations, nothing life-threatening, but some major injuries. And then once I stabilized everybody, we had to sort of, give them more definitive care. We emptied out our truck, because this was upside down, and loaded them in our truck and went off to what on the map was marked as a clinica. So we drove to this thing called clinica, and I expected to just hand off the patients. But in fact, there was one doctor there with very little in the way of supplies. I had brought more supplies than he had. And he had not treated this kind of trauma maybe ever. And he asked me if I would stay with him until we could get relief. So he radioed for some ambulances to come up from Lima, but that would take overnight. So I had to stay overnight with these patients, and I did, and took care of them and transferred them to the ambulances in the morning, and then left to go about our climb that we started out to do in the first place. Meanwhile, this whole incident had made big news in Peru, and we went about our climb, and we climbed this mountain called Yanapacha, which was 19,000 feet, which was a real achievement for me. But I have to say that after having summited Yanapacha, I still felt that the care I had rendered to these people in the wilderness was a higher summit for me. I got more satisfaction out of taking care of those people than I did out of summiting Yanapacha. And when we got back down, I found out that that incident had made local news. There was radio and TV stories about it. I was interviewed, and I sort of became locally famous for a short while in the highlands of Peru. And it just so happened, as fate would intervene, that the president of the Explorers Club was in the area at the same time I was on his own expedition, and he heard about me. He invited me to come back to New York and to take a look at the Explorers Club. I wound up joining the club. He sponsored me. I joined the club, and they said all the members have to have one good idea. So my good idea was to collect information from all the members of the Explorers Club, because they had been everywhere in the world. I wanted them to give me medical information, what problems they ran into, where they were, how they solved them, what supplies they took, what supplies they wished they had taken, where local medical help could be obtained in an emergency. And I started to collect a lot of this data. And what that did was make me the go-to guy at the Explorers Club. So people would come to me for advice, and then very often invite me on their expeditions. So very quickly, I went from having no idea even what an expedition was all about to being invited on more expeditions than I could possibly go on. So I got the reputation of being sort of like the guy to take on your expedition in the Explorers Club. And I got a lot of experience very quickly. And since there was no such thing as a Wilderness Medical Society, I was like a source of information for a lot of people on a lot of expeditions. And, my name got around. It was a small world then. And I just had tremendous opportunities to go on expeditions, and I refined my skills, that way rather than through any kind of academic program.
That's really cool, because it kind of speaks to, and when I talk to a lot of people who are accomplished like you are, a lot of the things that they achieved kind of stem from just developing personal relationships that over time evolve into more relationships. And then it basically started out with you climbing with a Green Beret, kind of almost, by accident, arbitrarily. And the next thing you know, that leads to the Explorers Club. And I don't even know if I've ever told you this, but I first encountered your work. I was going through my medical training with the Air Force, and I read Surviving the Extremes. And I'm like, wow, this is really cool. This is exactly like what I'm learning about right now. And I'm like, it would be really cool to meet this guy at some point. And then obviously it turned out that we had a couple of mutual friends in common. And then the next thing you know, we're doing, you were doing some training with our group in the Air Force, and then speaking at the my physical therapy program. And now we're doing this. So it just kind of, goes to show that with the right relationships and just the right network and meeting good people, how that can lead to all these different things. So on Surviving the Extremes, and I'm going to put a link to that in the notes to the podcast, because anybody who's interested in extreme physiology and the limits of what humans are capable of, I think that's an awesome resource. And even though the physiology is very thorough, it doesn't read like a textbook. It's actually pretty enjoyable, and you have some cool anecdotes. But just briefly for some context, can you talk about, you mentioned a lot about the mountaineering, but can you talk about some of the other environments that you've worked in? Because in the book, you're talking about things you've done with NASA and space and undersea medicine and desert, so extreme heat, extreme cold, just some of the different environments that you've worked in.
Yeah, I've done a lot of work with NASA, actually. Because of my sort of expertise, if you want, on the human body's response to very severe environments. Some of the stuff we did was undersea. We did this project called Nemo, which is it's an acronym for NASA Extreme Environment Mission Operation, and what that is a space analog. NASA has several space analogs, they call them, where they set up situations which mimic what astronauts would experience in outer space or on other planets. And this particular one, Nemo, is underwater. It's a mock space capsule, which is 2.5 miles off the coast of Key Largo in 67 feet of water. It's mounted on a reef. It's about the size of a school bus or so, size and shape of a school bus, but it mimics a space capsule. And what NASA does is they put 4 astronauts in there for 2 weeks at a time. And since it's at 60 feet, the astronauts are nitrogen saturated when they enter it, and therefore cannot just spring back up to the surface if something goes wrong. They have to decompress. So it very much mimics the situation in a space capsule in that you have several people in an enclosed environment. If something goes wrong, they can't leave. They have to fix it. Their life would depend on fixing what's wrong. Obviously, in a space capsule, you can't just sort of leave. So the astronauts all say this mimics the International Space Station better than any of their other space analogs. So the astronauts go in there for 2 weeks, and they come out every day to do mock spacewalks. Since, as you know, you're neutrally buoyant when you scuba dive, in some ways that mimics weightlessness because you can move up and down at ease. So they run experiments outside the capsule, and they call them mock spacewalks. They test different things and then go back inside and do other things inside. So the medical component of that was to see which method might be the best in an emergency situation for rendering medical care to an astronaut in space. The options that we considered were, number one, do you have to have a doctor on board? Number two, could you train an astronaut adequately enough to do emergency surgery? Number three, could the process be guided from Earth? So what we call telemedicine, which is happening on Earth now. Could you just have the doctor sort of oversee what the astronaut is doing? Would that work best? Or should we use robots to perform surgery? So these were all different options that we had to sort of test out in this mock space capsule in the sea. So we would have the astronauts do mock appendectomies, and we would do the mock appendectomies, and we'd have the robots do the mock appendectomies, and we'd see who could do it the best, and then review the studies. And it turned out that the astronauts were very dexterous. They could really, if you told them what to do, they could do it. But if they ran into the slightest problem, the slightest variation, they were totally at a loss. They had no idea what to do if it didn't go exactly as they expected it to, because they had no experience doing this kind of thing. So we found that telemedicine worked really well. We had a doctor in Canada who was working with us who would look through a TV monitor at the astronauts, watching what they were doing, and the astronauts in turn had a TV monitor in the capsule to see the surgeon in Canada. And the surgeon could literally say, move a little bit more to the right, lift your hand, that stitch is not good, redo it, look here, look there, and then the astronaut could say, am I doing it right? And he could look up at the doctor, and the doctor could sort of demonstrate what he had to do. And that system by far worked the best. So we decided that telemedicine is the way to go on the International Space Station. but the time delay on the International Space Station is less than 2 seconds, and that's okay. With a 2-second delay, you can do this, but we built in longer delays, such as might be going to Mars. The time delay going to Mars could be as long as 40 minutes, meaning that the astronaut would make a move and the doctor would see it and send back his critique, and the round trip time could be as long as 40 minutes, which is obviously completely impractical. You can't do any kind of surgery, you can't do any kind of emergency anything if you wait 40 minutes to get any kind of feedback from the doctor. So for that, the program that seemed to work the best would be to actually have a CAT scan or an MRI on Mars, or in the spaceship going to Mars possibly, and have the signal, have the CAT scan the entire body wherever the problem is, package that up digitally, send that back to the United States or wherever we're doing this, have doctors in the home country actually computer program an operation, and then package that operation, the entire operation from start to finish, package that back up and send it back as a digital package back to Mars or wherever it is, and that would be downloaded into a robot who would then sort of play it out like a player piano would play a tune from start to finish. It would just be programmed into the robot. That process is still in progress. That has not been perfected, but that seems to be the only way to really deliver significant emergency care on Mars, other than to have the astronauts, basically trained. So that was some really exciting stuff we did. I have some claim to fame there. NASA did about 14 of those projects. They're still ongoing. I was involved in 4 of them, and while I was there, one of the astronauts actually cut his hand while he was trying a procedure out underwater outside to what he would have to do to work on the International Space Station, a repair procedure. He cut his hand, and he swam back into the capsule because he didn't, bleeding in shark-infested waters is not a good idea. And he radioed for help, and I happened to be up topside when he did, and especially being a hand surgeon, I was able to swim back down and make the repair on his hand, and that remains the only time real surgery was ever done in a Nemo capsule. So maybe that's my claim to fame down there. So that was one analog, and since you're asking about it, we did a few things, but one of the other really interesting analogs we did was in weightlessness, because even though you're neutrally buoyant and it mimics weightlessness in some ways, there's still friction and there's still some gravity. So to avoid that completely, to get true weightlessness experience, you have to fly up, not into space, but into high altitude. What we did was we went to the Johnson Space Center, and they have a DC-9, which they nicknamed the Vomit Comet. And it takes off from Johnson Space Center in Houston, it flies out over the Gulf of Mexico, and then it ascends to 36,000 feet. And then from 36,000 feet, it does a nosedive down to 10,000 feet. It just drops. And during that drop, the entire contents of the plane is weightless. Everything inside is weightless because you're free falling. And it takes about 30 seconds for that to take place. So it goes up to 36,000 feet, nosedives to 10,000 feet. During those 30 seconds, everything inside is completely weightless. The people, the machines, all the equipment, everything's weightless. So we can then perform experiments to see how we would function in weightlessness, how doctors could function in weightlessness. It's far more complex than you might at first imagine, because just imagine when you have no resistance to yourself whatsoever, when you try to turn a dial on a machine, you have your fingers on the dial, and as you apply pressure, the dial won't move, but you will spin 360 degrees around the dial. and the thing just won't move unless you can stabilize yourself. And just imagine trying to do CPR in weightlessness. The slightest push against the victim's chest will not compress the chest one bit, but it'll send you backward across the aircraft. So you have to try to figure out how to stabilize yourself without, encumbering yourself too much that you can't function. So we were trying all these different techniques using Velcro here, there, and everywhere to try to figure out what's the best way to stabilize the practitioner who's going to have to perform some emergency surgery on his fellow astronaut. But my favorite part of that was we were suturing. We had these plastic blocks that we cut gashes in and then sewed them back up again. And you have 30 seconds to do this. So each time the plane drops, you have 30 seconds. Then during those 30 seconds, you're weightless. You do your thing, and then the flight officer will yell "coming out." And when he yells "coming out," you know that you're going to suddenly experience 3 Gs because the plane is going to loop back up again. So during those 30 seconds, you're trying the experiment. So we had doctors try it, we had astronauts try it, and we had the robots try it to suture during those 30 seconds. And when I was doing it, I remember my favorite part was you put in a stitch, you tie a knot, you pick up the scissor, you cut the knot, and then you can place the scissor like right in front of you in space, and the thing will just hang there, completely suspended in air. And then you can do your next stitch and re-grab that scissor, which you place wherever you want, and cut the knot, and then put the scissor right back in space. It's just the coolest thing. Then after 30 seconds, you got to tack everything down. The plane comes out, and you wait until you climb 36,000. You have another 30 seconds to do it. So that was our primary experiment, actually, on that run. And what we discovered was that the astronauts are every bit as good as the surgeons in tying knots, and that makes sense because they're skilled, they're smart, they're dexterous, they're motivated, and suturing is basically pretty easy. So they were really good at it, and both the astronauts and the doctors were still better than the robots, faster. So we still got some work to do with the robots. But those are 2 examples of how I worked with NASA in extreme environments to, at the limit of physiology.
That's really interesting because obviously there's all this talk about AI, artificial intelligence, and at least in your experience with NASA, human beings still are doing a better job than robots in some capacity. And then just for the record, I would never underestimate the complexity of doing surgery in space. So when you were like, "Oh, you'd be surprised how difficult it is to suture in space," like, no, I'm actually not surprised. But one of the things that's really, I think, unique about your writing and kind of the overriding theme is that the body has a remarkable capacity to adapt to stress and to extreme environments. And you talk a lot about like, the Sherpas at high altitude and the astronauts in a zero gravity environment, and then people running ultra marathons in the desert, and then even free divers. So this might be an impossible question to answer, but in all of your travels and your studies, is there any particular group of people or environmental extreme that you found to be the most impressive in terms of their ability to adapt to these kinds of stresses?
I think the answer to that is no, and it's a good answer to say no. Because what I have found is that the human body is so amazingly adaptable that the same basic person, the human beings, they really only come in 2 varieties, male and female. There aren't that many other differences in extremes. An Eskimo is really not that different from a Maasai warrior. They have 2 arms, 2 legs. They got the basic physiology, and yet you can take that basic model, and it will adapt to completely opposite extremes. You can take that basic model and you can get a desert inhabitant who can live in 120 degrees, and you get an Eskimo who can live in temperatures below 0 most of the year. So I think the key point is that the human body is so adaptable in so many different directions. I've always been amazed at that. Like some of the stories I tell was, like in the Amazon, I took care of a boy who really felt no pain despite a major injury to his wrist. His body was able to sort of tamp down any pain experience and just act smart, act as he had to do to save himself without feeling any pain. That's a remarkable survival instinct. And then I also tell the story of Beck Weathers, who was caught in a snowstorm on Mount Everest and laid in the snow for a day, a night, and another day, completely hypothermic. And any textbook will tell you that once you get hypothermic, if you can't get outside heat, you're going to die. Well, Beck was hypothermic for a day, night, and a day, had no outside heat, and he got up and survived. So
he was written off for dead, right? I mean, you tell that story in your TED Talk. Like they literally left him. They thought he was dead.
Absolutely, yeah. Two climbers came by, looked at him, and said, "He's dead." And Beck was actually conscious, but he couldn't move. He couldn't even blink to tell these people that he was alive. So they passed him by. Beck laid there for another day and night, and then he got the will to survive. He started thinking about his family and how much he had to live for, to come back to. And that gave him energy to actually get up, to stand up after being in the snow for that long a time. He got up and found the physical power to stand. And what I find is equally or even more incredible is he was able to think clearly enough. He couldn't see. Beck had lost his vision. He couldn't see, but he knew that he had been climbing with the wind to his back. And he reasoned that the direction for the camp would have to be into the wind. So even though he couldn't see, he had the strength to get up, the clarity of mind to pick the right direction and head into the wind and actually save himself. I mean, that's just an incredible story that you can't explain in medical textbooks. So here's another example of the human body's incredible capability to survive. I see it over and over in all these different environments. I've seen, cases that you just can't explain. Like one of the other mountain cases involved a Sherpa, who fell in a crevasse while I was there, fractured his skull. He was brought to me unconscious. His pupils were fixed and dilated. He had a fractured skull. He was unresponsive even to deep stimuli. And I did what I could for him, which I felt was, really like nothing, because I was sure this guy was going to die. I figured he would die if he was in an ICU. And here he was at 24,000 feet and unconscious. And I had very little in the way of supplies. I figured this guy is done for. But I started an IV and I just sort of tended to him as best I could. And then the other Sherpas came into my tent, into the medical tent, and sat around that night and chanted the entire night long. The Sherpas just sat around with their eyes closed and chanted. It was like a hypnotic kind of chant. It was hypnotizing to me as well. And in the morning, the Sherpa, my patient, opened his eyes and started yelling something out in Tibetan. And I said, what's he saying? And they said, he's cursing at you for tying him down. So this guy went from what I was sure would be, certain death to completely coming about. And we evacuated him out of there. And the expeditions on Everest last 3 months. This happened right at the beginning. Before the end of the expedition, he came back and rejoined the expedition. I mean, it was an unbelievable story. And I can't explain that. And I don't know anybody who can explain that, how someone could essentially be brought back to life by chanting. So there's so much in the human body that we don't understand, which goes back to what I said when I was a kid. There's more mysteries in the human body than anywhere else in the universe, and it's an endless source of fascination to try to unravel these mysteries little bit by little bit. And in that way, I feel like I'm an explorer of the human body as well as an explorer of the environment.
Yeah, and then one thing that was also interesting in surviving the extremes, you talked about how despite this amazing ability to adapt to stress, some of these sort of protective mechanisms through evolution that have allowed us to survive maybe in more normal environments can backfire at the extremes. So I think you used the example of like pulmonary edema. Maybe you can go into that as an example of how, some things that maybe evolved to allow us to survive and thrive in a more normal environment actually backfire when we're at these extreme places where humans really aren't necessarily designed to be, despite their ability to adapt if they've been there for a long time.
Yeah, well, humans are really only adapted. Humans were sort of built, more or less, if you want to say, in the African plains. That's where they were sort of constructed, more or less. So that's what they're really adapted to, and their bodies allow them to dissipate heat because that's what they encounter in the African plains. They're not really designed to take care of cold all that well, and in large measure, when humans go to extremely cold environments, the way they survive is not by body adaptation, but by protecting themselves in a way that sort of recreates a safer environment. They've invented things like shelter, clothing. They've harnessed fire. They've done things which give their environment make their environment back into what they are more used to living with. No one really does survive in extremely cold temperatures. What they do is find a way to not make that temperature so cold. That's what happens in outer space too. No one can survive in outer space where it's 0 degrees Kelvin and no air and no a complete vacuum. What they do is they bring along a portable environment which they've created through technology to keep them within the limits that they can survive in. And if you go outside that kind of limit, like when you go high up on Everest or something, your body is not really made to do that. Sherpas have adapted amazingly well by enzyme changes over 50,000 years. That they can use red blood cells much more efficiently than we can, but even they have a limit. And the human body, if it goes beyond that limit, it will try to protect. It will try to protect itself. Like if it senses it's not getting enough oxygen, this is like one example of what you were talking about. If it's not getting enough oxygen, the lungs will just try to get more oxygen by pumping more blood through their blood vessels. And it gets to the point where the pressure just gets too high. The body it just keeps increasing the pressure because it senses there's not enough oxygen. And eventually it will cause these blood vessels to leak. And the plasma, the fluid part of the blood, leaks out of the blood vessels, gets into the lung tissue itself, into the alveoli, the breathing cells, and it will fill up with fluid, and people drown. And that's what you call pulmonary edema. One of the other problems where the body sort of works against you in an extreme environment is what astronauts encounter in outer space when they're weightless. There's a big problem that NASA deals with in that astronauts often get very nauseous in space, and there's a lot of vomiting going on. They don't like to publicize that because, not that it's a secret, but astronauts have an image of being heroes. And it doesn't sound good to tell people that their heroes are throwing up, while they're in outer space. But that does happen a lot. And the reason it happens is because your body is designed to live on that sits on top of hair cells in your ear. And when the pebble is sitting on top of the hair cells, your body knows that you're upright. If you lean forward, the pebble moves relative to the hair cell. And your body knows that you're tilted. And you can tilt forward, back, sideways. Body's very good at interpreting that and knowing what position you are in. Now, when you go into outer space, you suddenly have a situation where weightlessness allows the hair cell to lift, allows the otolith to lift up off the hair cell where there's no longer in contact. Now, this completely confuses the body because it's not programmed for weightlessness. And whenever a otolith is not in contact with a hair cell, the body thinks that you're upside down. Because on Earth, that's the only way that the otolith and the hair cells lose contact, as if you're standing on your head. So in outer space, that's not the case. You're not standing on your head, but the otolith is lifted off the hair cell. Your body is telling you that you're upside down, but your eyes are telling you that you're not. So that causes confusion, and it causes very much a similar situation to seasicknesses, where you have a discordance between what you see and what you feel. And it causes a lot of problems with vomiting in outer space. And astronauts do vomit a lot in outer space. Eventually, the body's so amazing that after a while, on the longer space missions, the body seems to figure it out. And the vomiting goes away. Exactly how it figures it out, I don't think anybody knows. But it's just one more example of the body's unbelievable ability to adapt. And also in outer space, another interesting point is that astronauts lose muscle mass. It's a problem, but it's not an illness in the sense that the body is adapting. It's not really an illness from the body's point of view, because when you're in outer space and you're weightless for a long time, you don't need muscle power and you don't need strong bones. And your body is so smart and so adaptable that it takes away the energy that would ordinarily go into maintaining your muscles and your bones, and it uses it for other purposes in your body, because it's an adaptation. It's an adaptation to life in space. That's really what it is. It's not the body malfunctioning in that sense. Then of course you suddenly come back to Earth, which is all of a sudden you go from weightlessness to full gravity in a matter of a few hours, and your body can't readapt that quickly. So then you have all the Earth-related problems of weightlessness, which is thin breakable bones and weak muscles. But it's really an example of your body's incredible ability to adapt to situations. It's not the body gone wrong. It doesn't know.
I think is really impressive is that when you initially start to go out on some of these medical missions, like even the first Everest one that you did, there wasn't really much of a precedent for it. So like you said, there wasn't a Wilderness Medical Society, and you were kind of winging it and just trying to figure out, what to bring, and you were thinking of every possible contingency. But I don't think people appreciate how logistically intensive these kinds of missions are. And in the environments that you're working in, you can't necessarily just bring everything, because you can't just fly a plane to Everest, the highest point in Everest, and bring a portable emergency room. You kind of have to make choices and sort of triage even your gear. So, can you talk about how your process became more systematic over time, from when you were completely kind of winging it and just trying to write things on note cards, and then how you kind of refined that over the years as you got a little bit more experience?
Yeah, that's actually a good point, and that requires a huge amount of preparation in advance. You try to figure out, like you start out, the basic thing is what could possibly go wrong, and then you try to lay out medicines that would help you in every one of those situations, and then you wind up with a hospital, and you got to start cutting things down. So you look for medications and treatments and instruments that can serve more than one purpose. You try to get things down to just multi-purpose items, like a codeine pill. Codeine pills are great because you can treat them for pain relief. You can use them for pain relief. You can use them to treat a cough, and you can use them as a sleeping pill. So right there, you got three common problems in almost any environment that can be treated with one pill. So in that way, you try to find things that are good for more than one condition. Antibiotics, you try to take general antibiotics that have broad spectrums. You sort of look to cut down on the volume of different medications and things that you need to take. Whenever you can, you take a pill over a liquid. Liquids are bulky and heavy. You try not to take liquids if you can possibly help it. For upset stomachs, believe it or not, one of the best treatments is Pepto-Bismol. That works really well. But the liquid is heavy, so you wind up taking pills, because the pills don't work quite as well as the liquid. Liquid works better, but it's a trade-off. And you learn that in that case, the extra weight and volume of a bottle of Pepto-Bismol is just not worth the trade-off, and you'd rather take some pills. Then you got to figure out, if you bring it, can you even use it? What kind of sophistication do you need to use the thing? Should you bring an EKG machine? What if you had a battery-powered EKG machine? Number one, most people, although it's not true on Everest, most people are not going to have heart issues where you go, because they're generally young and healthy. So that would be a low priority. Number two, even if you detected something with an EKG, what could you do about it? Probably very, very little. So, something like an EKG machine is no. You don't take something like that. It's heavy, it's impractical, it's not likely to be used, and you're not likely to even benefit from having it, because you can't do the sophisticated treatments you need to do. And then, like in a place like Everest, you have to systematize what you can bring at what levels, because you can take a yak to base camp, So that pretty much gives you a lot of supplies. When I go to Everest on my expeditions, I was given 4 yaks. We had a 55 yak expedition. I got 4 yaks of medical supplies. So I can take a lot of stuff. But that all stops at base camp because the yaks can't go above base camp. Then from base camp, you have to go through the ice fall, which is the most technically difficult part of climbing Everest. It comes right away out of base camp. That's very difficult, and you don't want to take much through there. Number one, it's very difficult to maneuver supplies through the base camp, through the ice fall. And number two, the more stuff you bring, the more trips have to be made through the ice fall. And the ice fall is the most dangerous part of the climb. So you don't want to put climbers at risk by making them make extra carries through the ice fall. So that also very much restricts you. So in fact, I have like a mini hospital sort of at base camp because I'm pretty free to set up and bring a lot of supplies. But at Camp 2, which is on the other side of the ice fall, I only bring a fishing tackle box with supplies in that box, and that's it. That's all I've got. And that goes up to Camp 2, which is 21,000 feet. Then above Camp 2, my entire medical kit consists of 2 plastic bags, one of which I have preloaded syringes of steroid, and one of which I have preloaded syringes of painkiller, Demerol, because when you start getting up above 21,000 feet, what can you do? You know, you're on the side of a mountain. You can't really perform any kind of sophisticated thing. You couldn't suture a wound. You couldn't do anything like that. So the top priority would be getting somebody down. That's really all you can think of doing up above that height. And to get people down, I want painkillers to sort of help them if they got some kind of broken bone or something. And I want steroids because, as you know, when you go up at high altitude, it's very common that people develop cerebral edema, which is brain swelling. And it can be fatal up at high altitude. But if you give them a steroid injection, it will shrink their brain essentially for several hours, taking away the pressure of the edema, of the fluid collection. And that people go from sort of not knowing where they are to complete lucidity. And it lasts a few hours. And that can be a life-saving interval. In those few hours, you can get them coordinated, you can get them thinking clearly, you can get them down the mountain. So you got to think of what you can do and where you can use this stuff. There'd be no point in taking any kind of sophisticated equipment higher because you couldn't use it, and it would be heavy and bulky, and weight is such a priority at height. So you got to think about what you can use, you know, whether it's usable, what the odds are you're going to need it, and then sort of parcel it out as you go up, taking less and less as you go higher. That would be the case in Everest. And in every situation, you know, if you're going up by canoe, you can take a lot more. You have to really factor in what you're bringing where, because what I have found is a harder choice. I can figure out what meds to take where. The harder choice is taking how much. Figuring out quantities to take, I've always found a more difficult problem because, for example, on Everest, you have a lot of expeditions that don't have doctors. Plus, you're passing through villages that haven't seen medical care in a long time, if ever. And this is true in the jungle as well. And when you go past these people and they have medical problems and they know you have medical skill, they come to you for help. So my primary responsibility is to my medical team, which is maybe, you know, say on Everest I have like 10 other climbers and maybe 30, 40 Sherpas. Those are my primary responsibility. But passing through the village, we pass literally hundreds of people that need medical care. Plus you have another maybe 50 or 100 people in those days on the mountain who don't have doctors, who are climbers without doctors. So if they come to me with a problem, either a villager or a climber, how can I say no to them? How can I not treat them when I have the capacity to treat them? And yet, on the other hand, I'm using up my supplies on these people. And the situation could arise that I use up supplies on a villager or on a climber for another expedition, and then later on, one of my guys needs that supply. And what am I going to do if I don't have it? You know, I've abandoned my responsibility to my own team. So it's a real big dilemma. On the one hand, you can't not treat people who need your help, and on the other hand, you have that primary responsibility to your own teammates. So that I find the bigger problem is how much stuff to take, not what to take, but how much to take. That's really what gives me problems. And luckily, on my Everest expeditions, I've been very well funded. They've all been with either NASA or National Geographic. And we've had very good budgets, very high budgets. And I can take a lot of excess stuff just because I know I'm going to be treating other people besides my team. And what I do is I bring, except for the equipment, everything I bring along, all the supplies, I leave. I leave in the villages before I leave. So it serves two purposes. I have like insurance that I can treat other people than just my own team. And also, I'm helping to supply the village with some medical supplies that they desperately need.
Yeah, and it's the same exact dilemma with military medicine, which is why I think when we've collaborated professionally, there were so many similarities.
Yeah.
I think there's a misconception that people are doing like really fancy and sophisticated medicine, whether it's like on the battlefield or on a mountaintop. And the reality is, you're really just trying to get people the hell out of the bad environment so they can go to a more normal, treatment place with more resources where you don't have to make so many compromises. So in these extreme environments, whether it's, cold, heat, altitude, or even when bullets are flying, the idea is get the people like away from the threat, which could be the environment or an enemy force, and then get them to more definitive care. And really all you're doing is just kind of stabilizing them with very limited resources. But the idea that you're going to do a really sophisticated surgical procedure on a mountaintop, I think you and I know that's not necessarily the reality. But,
right.
If you watch like a movie, you might see, wow, this is like what these guys are doing is amazing. But that's not how it really works. I mean, even as the provider, you're like, it's very hard for you because you're enduring the same environment as the patient.
Yeah.
So like you're cold too, and your dexterity is worse, and you're hypoxic, and it's kind of it's not good for anybody involved, really.
Yeah, that's the point that I was going to make. Also, you, the treater, the medical provider, you're in that same environment. People don't seem to realize that. If it's below freezing, it's below freezing for you too, not just the person you're treating. People I think often don't appreciate that so much.
Yeah, and one thing I loved the way that you ended surviving the extremes. That's kind of I want to ask the last question, kind of along the same lines, where you talk about how we have all this knowledge about physiology and science is evolving at such a rapid rate, and we've been able to answer so many new questions about how the body works. But you kind of end the book where you talk about, the will to survive, and there's so much stuff that we can't quantify, and there's so many things that science has yet to really discover. And you talk about, even in your TED Talk with Beck Weathers, how, if we were to hook him up to some kind of neuroimaging, we could see all the different activity levels in various parts of the brain while he was trying to survive and generating that will to live. But again, it doesn't tell the whole story. So I guess what I want to ask you in closing is, what are the really important questions that we have to answer from a scientific standpoint? And/or are there certain things that should kind of like remain mystical and almost spiritual from a survivability standpoint?
Yeah, I think when you try to figure out exactly how the brain functions and how it manages to power the body, it's such an overwhelming, complex problem that I honestly don't think it will ever be solved, because each mystery each time you discover something in the body, it just opens up more mysteries. And I think it does get spiritual at the end, because if you think about any scientific pursuit, in order to study an object, you have to be able to step outside of it and look at it objectively. And we can never step outside our brains. We use our brains to study our brains. So there's going to be a fundamental bottom level, so to speak, a basic level that you can never penetrate, because you can't get outside your brain to actually see what's happening there. Even if you build a computer or whatever you want, you're using your brain to build that computer. So there are going to be certain characteristics that are innate in everything you do. It's like if you put on red glasses the day you're born and never take them off, you won't understand the color red, because everything's red. It just won't be something that's in your consciousness. And in the same way, when you use your brain to study your brain, there's going to be some basic functions that you're never going to be aware of because you're using those functions to study those functions. So there's always going to be some basic level that you cannot penetrate. And in a case like Beck, when you try to figure out exactly what went on, you're going to get to the point where you cannot penetrate the absolute art. It's like the Big Bang. Like what happened before the Big Bang? What powered the Big Bang? Like what powered Beck Weathers? What was that got him up? Was it something inside his chemistry in his brain that we'll never be able to figure out because we're using our own brains to figure it out? Or do you want to have the spiritual belief that he was powered from the outside? That God gave him the power. God instilled some power in his brain that allowed him to get up and move. I mean, that explanation is as valid as anything else. And I think, if you want to believe in faith, you can believe it that way. If you just want to believe that it's all mechanical, but we'll never get to the bottom of it, either way, there's that mysterious level that I think we will never penetrate.
Yeah, I think that's a great way to end it, where essentially there's just some level of uncertainty that we have to embrace despite our sort of relentless pursuit of knowledge. Well, I mean, thanks. That was, again, I think that's the perfect way to end it. So I'm gonna provide some links to some of your previous talks just so the audience can learn more about you. But thanks again so much for your time.
Thank you, Doug. It's a pleasure talking to you as always. And let's get together soon, okay?